Welcome to the Brain Body Fit podcast. I'm Dr. Jerome Rerucha, and I'm here to help you cut through the noise of fads and quick fixes and focus on proven strategies for optimizing your health and peak performance. Join me as we explore regeneration, anti-aging breakthroughs, nutrition, and the power of improving your physical and mental strength to unlock your brain and body's full potential. Welcome, everybody, to the Brain Body Fit podcast. Today, we're going to be talking about some cutting-edge technology called Intermittent Hypoxic-Hyperoxic Training. And we have David Chamblee, who is an expert in America here, who's bringing this cutting edge to the clinical world, elite athletes, and everywhere in between. So this is one of those really premium Brain Body Fit products that we like, because if you're looking to be the best of the best and improve upon your multiple world titles, this absolutely can help with your conditioning, your recovery, as we're going to find out, learn about the physiology of it, as well as even in other countries, this has been around and aware of for a lot longer than here. And people who are really, really sick with very significant chronic degenerative diseases, you could just decrease the intensity of this, but very, very valuable. And David has a tremendous amount of experience working on all people, as well as explaining and teaching it to others. So welcome, David.
Thanks, Jerome. It's good to be here.
Why don't you just give us the short definition before we kind of dive into it, give people an understanding of what IHHT is?
Yeah, so IHT is intermittent, as Jerome said, intermittent hypoxic hyperoxic training, conditioning, exposure, all three of those. The conditioning and training aspect of it is more movement oriented, which makes things happen faster. The exposure is just, no movement at all. It takes longer and results are slower. But what we're doing is that we're exposing someone to low oxygen. So if you breathe, for instance, where I am here in Athens, Georgia, 21% in the air, 20.9, and we take them down to 13, 12, 11, somewhere in there. After a couple of minutes, the body starts to recognize that, okay, we're not breathing the 21 that we're used to breathing. So what are we going to do? If this continues, we may not make it. So that's the body's thought process. And so what the body starts doing is starts compensating. So compensating as in, it'll start to open up and vasodilate, looking for oxygen, kind of swelling, looking for oxygen. Your body will start creating more red blood cells. And then also your heart rate's going to increase as well because your body's having to work that much harder. So when those things are happening, you're in a prime place to absorb more oxygen or absorb maximum oxygen. So when we get people in that state, which usually takes a few minutes, then we flip the switch and now we flood the body with about 80% oxygen. And what it does, it just puts speed and momentum behind the oxygen to drive it deeper into tissues, nerve endings, brain. And so literally, you're just driving oxygen deeper in the body through this process as opposed to just breathing it, which that'll get the low-hanging fruit. So you do that over about 15 to 20 minutes. You'll do 3 or 4 cycles in the typical type protocol of the low to high, low back to high, create a demand, meet the demand, create a demand, meet the demand. And it'll last about, like I said, about 15 to 20 minutes. And there's a lot of different directions to go from there, depending on, athletic performance and conditions of health and all that, on how you would do that, but that's the basic protocol.
Yeah, it's really accurate. I've done this a couple times, and even though that was a very accurate explanation of it, until you get on one of these units and you really feel the significant difference compared to what other people might consider oxygen therapy. So everybody's aware of when they're just watching TV with athletes, commonly people go to the sideline, especially at more professional sports. They have oxygen tanks on the sidelines. They start breathing in. So everybody gives the oxygen the credit, but there's really this epic balance between O2 and CO2 that we're going to jump into. And so that's one thing people may be thinking of. And this is significantly different, especially when you contrast normal oxygen states with exercise put the high CO2 content, so the CO2 raises in the body by decreasing the oxygen accessible to people. And then as you flood the oxygen, it is a massive sympathetic, parasympathetic. It gets into oxidation reduction. It goes into the mitochondrial chain, as we're going to talk. So a lot of clinicians are listening to this. The mitochondria is a big deal. A lot of people on this podcast are doing a lot to influence the mitochondria, and they may not be aware of intermittent hypoxic-hyperoxic training, and it is truly a game changer. So it's a great report of findings to give people, but there's nothing like being on it. Some people might not be aware of what it looks like. If you're driving your car, you won't be able to see these pictures, but I do have it for those of you watching on a screen. So I don't know if you want to describe that with the concentrators and even the bags that people are looking at.
Yeah, this is a system that is a 2-user system. You know, most of them out there are 1-user, but you know, you can do 2-user, 3-user, 4-user. You know, some of our we put one in at a university recently. It's a 4-user system for athletes, but this particular one's a 2. And so what you're looking at, the main bag in the middle, that's the high enriched oxygen. So that's the oxygen that's going to be at 80% or right at 80%. Sometimes it goes a little over, a little under, but around 80%. And then you see the 2 bags on the side. Those are the hypoxic bags or the low oxygen bags. And those can be set on this particular system at different levels. So in other words, you could have an athlete working over here on the right that could be at like 9%, right? Which would be up to, 22,000 feet of altitude. And the one on the left, you could have it set at like 14%, which would be about 11,000 feet, 10.5. And that's usually the starting point with, people with chronic conditions at sort of 10.5. We can even go up to 8 or 9 if we need to at 15%. But yeah, so that particular system, the hypoxic bags, the small ones, the big oxygen bag in the middle. And then there's a switching mechanism, which is in the boxes that are on the inside of these oxygen concentrators. And it's run by an app. So on the app, you can change from high to low. So you can push the mountain to go to the hypoxic bag, the small bag, and then back over to the small bag, the larger bag for the high oxygen. So it's all app driven or app run. But yeah, that's the basis of it. And then those concentrators there are adjustable so that you can adjust the different levels of higher hypoxia or lower hypoxia.
Yeah, we're always trying to get data analytics in Brain Body Fit. We do the standard ortho-neuros. We do a lot of functional lab testing. We have a lot of functional testing within the strength and conditioning world, flexibility, strength through flexibility. So we're always trying to gather data to find asymmetries, weak links, whether it's in the structure, the nervous system, the metabolic system. And this is no different. So one of the things I really liked about this too, using the pulse oximeters is one of the things you guys do, but to measure oxygen on the fingers. And I know I was exposed to this years ago. But oximeters, I had those in the clinic for, a long time. And initially when I first started using them, I'm like, oh, this is great. This is really a lot easier to get pulse rates on people as well as oxygen levels. And then you kind of find out it's like you work on some really sick, obese people and their oxygen is still like 97, 98, 99, 100, And then even someone like myself or a conditioned athlete, you're always at 99 or 100. So you're like, gosh, do these things even work? I mean, how can this person who is so unhealthy, low physical capacity, terrible body composition, how can they be scoring like that? But they're at rest. And so then COVID came along and that was like, wow, holy cow. You really got to see some of the oxygen deprivation in people. But even more pronounced than that, when you use that oximeter doing this, it is very impressive to see how the oxygen and CO2 changes in the body within seconds almost, not just 2 or 3 seconds. You'd really have to do high intensity, but you just do a 15 second, a 30 second, and it is a profound drop. And being on the unit itself, it's not scary. It's not dangerous. This is incredibly safe, as we're even going to show you, again, research papers in other countries that they're doing this on very, very chronically ill people. But it is very unique to where there's no resistance to what you're trying to breathe. So even though you start struggling in breath as your oxygen levels drop, it's not like you can't fill your lungs up, like they're working fine. And it's a weird feeling. So it's a little different than a drowning feeling, but you definitely notice you are being challenged with oxygen, but you can breathe freely. You could absolutely feel that sympathetic, parasympathetic adaptation survival mechanism trying to hit. And then when they do flood the oxygen back in, it's an incredible relief if you're doing it at an athletic level. But then to watch that data as far as how it drops and how fast your recovery is, like the changes that occur in this in a short time, whether people have COPD or you are an elite athlete, it is amazing to watch those physiological improvements of how fast your recovery improves, even within one session, as you start priming and you do cycles like you mentioned. So I don't know if there's anything you wanted to add to that or...
Yeah, the pulse oximetry, we do bilateral pulse oximetry readings. So we're doing it on both sides of the body, and that's really important, like Jerome said. And for those of you who are, more have been trained medically, sometimes it's kind of hard to conceive trying to drop somebody down to 70 or 68 or 72 on a pulse oximeter on purpose, because normally they're rushing those folks to the hospital. But we're doing that with this system on low, and not everybody gets that low, but we're trying to get them ideally below 85 or so, in the mid 80s. And that's telling us that we're getting into the place that we want to be, right? When we can drop them and get them down to the 80s, really 92 and below is where you want to get them, but you want to really mid 80s. That's the area, that's the sweet spot where all those compensations that the body's going to do starts happening, where the more red blood cells are created, the vasodilation, heart rate. And so that's really important, as he said. And yeah, those numbers can move around and do some crazy things. And really, it's not really how they go down, but it's how they come back up is what we're paying attention to. So if one side's delayed significantly, there's always a reason, right? It could be right side, it could be liver. Everybody, no matter how healthy you are, the liver's going to pull oxygen to it. So the first time somebody does it, we're like, right side, probably liver. But if there's a pattern that forms and one side just doesn't, come up and regulate with the other side, and if there's always a delay, then that's when you start asking questions. What is going on? And it's amazing how there's always something going on, right? When that kind of stuff happens. So yeah, the pulse oximetry is important. That's kind of a whole science in itself, just learning how to read those numbers. But yeah, very important in this.
And in chiropractic, functional neurology has always been a huge part of the chiropractic education and application, as well as understanding of what we're doing with our exams. Now more than ever, the Neurodiplomate program has gotten more and more important. So even though David mentioned some things about organs, obviously this is going to affect the brain. And again, that whole sympathetic, parasympathetic, and the great details that even the Neurodiplomates function in, this would be really exciting in terms of the work that they're doing on concussions, learning disabilities, just chronic disease from a very standard neurological perspective. As we really get into the physiology, obviously they don't need any explanation of the mitochondria, but to really be reminded of the basics and how important O2, CO2, you're looking at the Bohr effect, how all of things happen as we are working through those phases of mitochondria and the entire respiratory chain, and how that respiratory chain affects the entire metabolic system, whether you're looking at glycolysis or oxidation. It affects every single cell in the body, whether you're coming at it from a metabolic perspective, whether you're coming at it from a neurological perspective. This is truly a whole system modality. And again, I have a picture up here you may or may not be able to see. There's lots of variables that you can do with activity. And people who are new to the show or people that have known me and gone to my lectures forever, everybody knows that I'm really big into activation in the clinic, what I call clinical performance. And it has to be scaled. We're not treating sick, injured people like athletes, but there's so many principles that if you can make a healthy, strong, fit person healthy, stronger, and more fit, if we decrease the intensity to the point that a sick person can do it, there is no ceiling to how you can help these people. And this is exactly one of those modalities that if you can get out of the wheelchair, and even if you're in a wheelchair, there's some upper body things you can do. There's so many different activities. In this picture, we have a gentleman who's on a treadmill, which is a common methodology. But David, why don't you go through some of the common activities that you do on people, but it's also not limited to what we're going to do. There's literally hundreds of things you could do.
Yeah, there's quite an array. You have to look at who you have and what they're going through, and kind of make that judgment on, okay, how are we going to bring the SpO2 down to the below 90, right? That's the goal. How do we do that? Doesn't matter how we do it. It's just that we do it. So that's the key. So when you look at that person, evaluate, okay, can this person get on a bike? Do they have enough balance? Do they have enough strength? If not, maybe a treadmill is the answer. Maybe their balance is off, or maybe they're chronically ill. Maybe a recumbent bike. So we have all those modalities. And then, if they can't do any of those, then it's a chair, right? So, okay, we got a chair. Can you stand up and sit down? You can't stand up and sit down? Well, can you move your arms? Can you do some type of arm movement? So you just kind of go down the hierarchy of, okay, this is the highest level. What can they do? And what are they going to be comfortable doing is another key as well. And yeah, so once we figure that out and figure out what we have, we're going to give them oxygen for quite a while, and we're going to read the pulse oximeter, because just like Jerome was saying, if I've got somebody reading 100 on both sides sitting on the couch before they even start the session, I know we have a problem, right? Because if you're reading 100, that means you're not releasing any oxygen from the blood. And the ideal number we want is 98. 97 is okay. Some of your high-end athletes, maybe 96, 97. 98, that's great, because that means they're releasing 2 to 4% oxygen from the blood, getting it to the tissue much quicker, which means they're utilizing oxygen at a very high level. So that 100, that's a red flag. We don't want that. Sometimes they'll hit 100 during a session because you're breathing all the oxygen, but we look at those levels and see where they are. Somebody who's really chronically ill and has a lot of hypoxia internally, even though you're giving them 80% oxygen, they will drop. Sometimes they'll get into the 50s and 60s, which makes no sense to a lot of folks, because you're thinking, okay, if you breathe 21% and you're 98, 99, and then all of a sudden now you're giving me 80% and I dropped to 60, what's going on there? Well, as the body sees all this oxygen coming in, for a lot of people for the first time ever, that much oxygen, well, the body gets excited because it's thinking, we got hypoxia, we got areas that need oxygen, and now we have all this oxygen coming in, so it starts sending it down to the areas that it's needed. So as that oxygen uptakes in those inflamed areas, hypoxic areas, that's going to drop those numbers, and that's why those numbers would drop on high oxygen. So we like to evaluate that first on high oxygen, usually about 5 minutes, and to see if we have that scenario going on, then they need to do a lot more oxygen to get those levels up to a healthy place before we go to hypoxia. Now, somebody who's healthy and they're an athlete, we do 3 minutes and all their numbers are great, they look great, then we go ahead and go into the hypoxia. So that's kind of how we start sessions. And again, it can go on the scale of any of those types of modalities depending on health and what they're comfortable with.
And the surface area of the lungs is massive. So, even with the pulse oximeters, you're putting it on fingers. I suppose you could even put them on toes. But as you're measuring, the whole oxygen, CO2 through the whole body, but just even from that premise of just being reminded of the huge surface area in the lungs. And when people don't have some challenge of intensity to their airwaves, like you literally could use only 20 to 25% of all your alveoli in your lungs, and the others just become dormant, they become congested. That's why we really do have so much predisposition yet to lung symptoms and problems, as we'll talk about going down the road. Of course, it still relates to the adrenals, which then take us into the whole endocrine system, which then takes us into the whole nervous system. So there's always that cascade, but we don't want to overcomplicate it. And the thing is, even if you don't know all those things of how it interconnects in a stair-step fashion, the machine does the work for you at just the training that David does. I can't emphasize the importance when you're working on sick people. They have such a passive lifestyle to where we can appropriately engage them. Another method of oxygen delivery that people are very aware of, and I think it's great, it's not a substitute for this, is hyperbaric chambers. So One thing, a hyperbaric chamber, there's rare instances, there's hyperbaric rooms. They're very expensive that you literally could put a piece of equipment in there so you could move. But for the most part, you're lying very passively. And I get it if you're an incapacitated person, like with strokes, severe neurological degeneration that you can't move at all. And there's other instances. I think it's great. It has a premise. It's very different than this. Using both on myself as well as on patients, this is very exciting to me. It's much more cost effective. It's much more functional in a space for how I practice. And the activity, when you put really sick people on this and you start priming that pump at that cellular level, in most times, and you can share with some of the things we'll get into, just some of your experiences, like just one session, even incredibly sick people will not only have measurable improvements, but they'll tell you how different they feel.
Yeah, I'll start with that with actually a pretty healthy person. You see that picture we're looking at now, the guy doing the session. That's Dallas Diamond Page, who's, DDPY yoga, and he was a WWE guy, does stuff with Joe Rogan and helps a lot of celebrities and broken athletes kind of get their health and life back. So that system there is at his place that we put in a few weeks ago. But so the first time he had heard about what we do, the IHHT, he wanted me to come Thursday, Saturday, and Monday. He wanted me to come 3 times to his place and put him through sessions so he could feel the experience. And he was a big hyperbaric guy, had 2 of the high-level chambers at his house. I think he had one that was 2.2 atmosphere, about $100,000 machine. So he came over, we did that first session, and I remember he took his mask off and he said, "You don't need to come back Saturday or Monday. We're good." He goes, "I know this works because I feel it big time here." And so he ended up selling one of his chambers. And then now he basically just uses this because he said he really feels it here, the neuro. And that's what he's going after for him, the neuro, to make sure that he's healthy and stays ahead of, neurodegenerative diseases. So he's a healthy person. But in terms of most people, the experience, as Jerome was mentioning, the breathing issues, that's where you see. That's what I know. One session, 15, 20 minutes, are going to feel a significant difference. Someone with COPD, even asthma, even some people that have some real chronic lung conditions that you can't, they're probably going to die from. Giving them a session will give them some tremendous relief for several hours. In COPD, usually that'll last for a day or 2 between sessions. And it usually stretches out further the more they do it. And, someone who's got any kind of energy issue like Epstein-Barr or someone with chronic fatigue, that's a right away as well, because they're so drained and hypoxic internally and they're just not getting any energy to the cells. This just turns them around really quickly, and they'll crash again in a couple of days. But again, the more they do it, it'll stretch out where they can go 2 days and then 4 days, and then pretty soon they can go a whole week between sessions because they build that up in the body. And then when you've got issues with people, especially performance type stuff we run into, some of our athletes get stuck in plateaus. They just, this is where I am, I can't get beyond that. And they start doing this, the IHT, and they'll very quickly start to break through and break through that plateau and start hitting new highs. So we see that quite a bit as well. And it's the same thing with just general person. Let's say you're a, 62, you feel pretty good, but you just can't do what you used to. You're slowing down a little bit. Maybe your workout turned intense. You have to be more careful. You start doing this and it just kind of takes you back in time a little bit, where now you start to hit those gains quicker. You can do more like you could before, and you recover much faster. So it helps all different levels of people, depending on what you're doing. But sometimes if you're a really healthy person and you're just doing it just to stay ahead of things, you'll definitely feel it here. But physically, it takes more time to feel it because you're trying to get a performance gain and maybe a recovery, accelerated recovery, and you start seeing that, the next week or 2. But the people who are chronic, those are the ones who feel it, right away.
Yeah. And to give people kind of an idea, so the concentrator that's on here, it's about the size of a full-size carry-on bag that you would take on an airplane. It does have an air hose with a secured mask to the face. So very commonly people are using treadmills. So you have to be in an area. You got to be in a radius. You can't do everything. You're not going to be able to do sprints with this at this point. Well, you could on a treadmill, but not without a treadmill. But, so some other things, we do squats with this. You could deadlift with it. When you're doing high intensity training type methods, you could do kettlebell swings, you could do windmills, you could do wall balls. So you can do burpees with it if you just reposition the hose just slightly. So there's a lot of creativity that you can do with this to change the physiology. But again, don't make it complicated, especially in a clinical setting. You're really going to do more of the recumbent bikes, the treadmill, the stationary bikes, super common, an upper body ergometer. I mean, for anybody who is in shape at times, you can be, and you just pedal with your legs all the time. You get on an upper body ergometer, and it's pretty humbling, even without varying the oxygen and CO2. So that is always a fantastic one. There's going to be a little different neurology. But yeah, when you start moving those arms, it's a whole different game besides just being conditioned with your legs. So really some great variations that you can do. Convenience, I have a picture shown up here. This is a bigger space than you need. I mean, obviously these are in large performance centers, but if space is an issue, I know for some clinicians, they have some pretty small rooms that they would just have a normal table in, whether it's a massage offshoot or small adjusting rooms. Some of them are as small as 12 by 12, for instance. You literally could fit this in that room. But again, why don't you just reiterate, David, because you got experience with every type of person from clinics, small clinics to home use, a lot of home buyers because they're just not getting the help that they need. So very popular market, but ultimately we want to get this in the hands of professionals, clinicians, and performance centers. It is just a competitive game changer. It is a clinical game changer.
Yep. Yeah. So that's my studio here where I'm at currently. And you can see the setup there. And you've got, the bag there. If you look at the bottom of the bag, and this particular one, that's the hypoxic bag. And then the top is the hyperoxic, and one that goes back and forth. Now that concentrator right there, as you can see, a lot of people ask questions about that. That's a specially modified concentrator. It's not one you just pick up and, hey, I want a concentrator. These we have to get specially made that control the hypoxic and the hyperoxic side. Normally, it would just do the hyperoxic, the ones that you see in medical settings. So this is a performance modified concentrator. And, it also, in terms of, use, you've got, for instance, I think one thing that Jerome's mentioned before and some of the stuff that he does and that I do as well, and when you combine these things together, I think it's pretty powerful. But when you have someone, and I have a guy now that has just recovered from surgery, and so he did it prior to surgery for about a month, and then continued after when he was well enough to do it, and his doctors were just amazed, saying, "Wow, your recovery is like we never see this. This is crazy how fast you're recovering." And then his insides, they said, looked like just like a very healthy person, not like what he was having surgery for. And so I think you can also, use this pre and post surgery to really help that recovery aspect. And I know what Jerome's talking about, lasers and different things like that, and you can combine this. I mean, heck, you could be back in probably half the time than you normally would be.
Without a doubt. This episode is brought to you by Life-Based Professional Healthy Eating Systems. We all know intuitively that the food we eat affects our shape, our health, and our performance. But every day we're inundated with new quick fix diets or gimmicks that claim magic promises and for most failed results. Nutrition really shouldn't be this confusing. Life-Based is the solution that promotes eating real food and optimizing your individual needs without fads, gimmicks, overhyped supplements, or fake prepackaged foods. Life-Based Solutions is a complete system helping anyone know what to eat, when to eat, and how much to eat. The Life-Based system offers medical-grade body composition, client education, and state-of-the-art data analytics to optimize your individual needs and achieve maximum outcomes, complete with live coaching from a credentialed professional with experience. Go to lifebasedsolutions.com to learn more and contact directly. Whether you are a client looking for coaching or you want to start your own life-based professional business, eat better, look better, and feel better. lifebasedsolutions.com. I mean, again, to feed off of that, so laser therapy is well known, even has FDA clearances, specifically zirconia lasers for pre-surgical procedures, post-surgical. I'm going to do a whole separate podcast on that, but that's very proven. And some of it, where we're talking about the mitochondria, people can say, well, I'm already doing that. And I'm not arguing that lasers are phenomenal. Obviously, that's one of the things I was very well known for decades and still use just as intensely today. But we're always looking at how can I make the adjustment work better? How can I make the laser work better? How can I do IHHT? And how can I make IHHT work better? And there are different mechanisms through that whole mitochondrial chain. And it's the perfect complement. So, lasers through the photon donating electron to go through the electron transport system, yes, doing that because you're creating ATP to injured cells. It can improve the efficiency of oxygen and CO2, but here we're directly affecting that and we're not using a photon. So, I mean, it is literally a match made in heaven. You are coming at it through such complementary physiological pathways. And the other one I would mention too is PEMF. And we'll talk about that. I'll show you, as we get through this a little bit, but for clinicians, that you already do have a lot of experience, even in pre and post-surgical successes and healings of those facts. I mean, without a doubt, those things work. I don't want you to stop doing them, but I will promise you start integrating these things, which is always the foundational principles of Brain Body Fit. Make it practical, but integrate things. And it is incredible the next levels that you can get with people. Now, you've done a good job on this. When I first introduced to this, for so long, in the strength and conditioning world, people are always talking about how can I mimic altitude training? So, that was the first thing that when I got on it, just the feeling of it, I'm like, holy cow, there's so many things out there that kind of make claims, do this, try to alkalize the body. I mean, even as simple as baking soda. And I'm not saying that doesn't do something, but, taking the baking soda, doing without going to altitude to train, even putting those resistance masks on. Now that's going to work the muscles of your lungs and your intercostals, just resisting the air. It's not greatly going to affect the oxygen CO2. I'm sure it does it some, but it's nothing like this. And so you did a good job, but we have the chart back up here. And this is what we're really looking at, whether it's the clinic aspect, but when we start getting to strength and performance. So if you want to just briefly go through this chart again, you did a good job at the beginning. It's right behind you, but then whoever names you can, tell with your experience in the strength and conditioning world, is obviously some people have contracts. They got to be, but.
Yeah, certainly as you look at the chart there, the colors, the green, we're going to start most people out in that green, some in the yellow, depending on, if you're an athlete in really good shape, we'll probably start you out in the yellow. If not, probably the green. But as you can see, when you look at that, that's 7,000 to 9,000 feet of elevation. So, the very edge of the green toward the yellow is where we'd start the lowest. We don't really go 7 because that's just too easy for most people. But everybody's going to start in the yellow no matter what, if not the green. And then as you advance a little bit, you go into the red. And as you can see in the red, now you're down at anywhere from 9 to 12% oxygen. Remember, you'd be 21 in the air. So you can see, the altitude, 14 to 22,000 feet there. A lot of people that really get into it and really want to progress are going to get into that. Now, you're chronically ill folks. I mean, believe it or not, the less they can do, the lower we take them, right? So if you can't really exercise that much and we're sitting in a chair doing some slight movements, we're limited on that, then we'll take it down lower because they're going to get a response faster, right? And we're going to drop that number quicker and get them to where we need to be. So somebody could be in the green and really have to go hard to get to that level where you just take somebody and sit them down and you can take them into the red and get them to the same place, right? And then, of course, now you've got your elite athletes. I've got a handful of the guys who are just, out there trying to conquer the world. And they're going to be in that burgundy, that very bottom down there, that like 9 to 8.5%. That's really hard to do. You wouldn't do that for the first time on anybody because you'd choke them out pretty quick because that hits you pretty hard. But once your body adapts to it, you build up enough EPO, red blood cell count, you start desensitizing yourself to the CO2, and your body starts using oxygen more efficiently. Then, of course, you can do the right. I mean, I do that lower part there, and I'm not a world-class athlete anymore. I'm older, but I can do it because my body's conditioned to it, right? So it's all about what you get conditioned to. And so really, when you can do that kind of thing, it's kind of an exercise hack, right? And I have people here in my studio over and over again say, wow, all the stuff that used to take me a month to do, I'm doing it like in a week or 2 weeks. It just speeds everything up, right? Because when you're on that low, you burn a lot more calories. Your body has to work harder. Then you start creating, all those extra red blood cells as carriers, and you start conditioning the body, desensitizing the CO2. All your oxygen efficiency is just getting really streamlined. And then you're just going to be able to perform better, do better, recover faster, all sorts of things. And that can go anywhere from, your immunity. It's going to really strengthen your immunity because you're getting rid of the weaker red blood cells that don't like that environment on the low. The strong ones remain. You replace new red blood cells coming as well. So you have a lot more healthy, robust red blood cells in the body. And then all your major organs, because if you think about it, especially when you're on the low, and again, the people who are really want to, for health and wellness and performance, not so much the chronically ill, and they want to move that needle faster, it's all about, we end up doing 90% of the hypoxia and only 10% of the high oxygen, right? And what that does after, 4 or 5 minutes, all that period following that in hypoxia, you kick into an autophagy process with the body, and the body gets really efficient, and it starts to prioritize what's important, and the body just gets stronger. And if you can handle that kind of thing, and your body tells you, yes, I can do this, and you do it on a regular basis, we call that the lean and mean when you're down in the red in that burgundy area there. And it just forces your body, it just wakes everything up. And then believe it or not, the people that come to us with cancer and these diseases that they, is terminal, the doctor says we're just not, prepared to die. We have a few of those. And I'm not going to tell you that we heal cancer, but we've had some really good success stories. And, it's the hypoxia that does it, because you got to remember a couple things here. We talk about all that hypoxia, because a lot of times, the red flag goes up when you talk too much about hypoxia. But again, when your body can handle it and you have the levels that you already need, and we measure that first, and then you can go into hypoxia for a period of time, the body is going to adjust to that and make you a lot stronger. And then following that, you got to think about this too. You can take 100 breaths of oxygen with no demand, and it's going to get the low-hanging fruit. It's going to give you some benefit, but you can do that same thing. Now create demand, and now 2 or 3 breaths of oxygen will be more impactful than 100 breaths of the enriched oxygen with no demand. So it's all about the demand and being strategic on when you give them the high oxygen, and it's going to go much deeper. And after doing a long, long low like that, 3 minutes of oxygenation at a high level of high oxygen is all you need to fully saturate the body at a really deep level.
And you and I only live about an hour and 15 minutes away from each other. Athens, Georgia is about an hour away. So a lot of elite athletes there, as you're kind of tapped into that community, and obviously a lot of post players who come back and circulate around the area. You're also involved with pro teams, Division I college teams, obviously being close to Athens. So there's a constant stream of athletes that are looking for you. Even when you've come, initially when we were demoing this at my place, and, one of my clients is a pretty high level mountain biker, done lots of races. He's in good shape, and we're on very low elevation. I mean, I don't know right off the top of my head, but it's super low here. So, there is no opportunity for altitude training, and we don't have mountains here either. So even though he gets invited to the races in the nation where they only allow 30 people invite only or 50 invite only, he gets picked to go to those. So he's in good shape. And when we put him on this the first time, and he was just like, wow, holy cow, that is an absolutely amazing workout, especially in the time duration that he did, and just so powerful. So can you share some of the stories with like some of the elite strength coaches? We're not going to go through the huge list, but I think some of them that are open to talk to is at a school in Arizona as well as Minnesota, if you would to touch base on those things.
Yeah. Yeah, one of the Cal Dietz is a guy up at the University of Minnesota who we were able to engage him probably about 2 years ago initially, and he was able to get the technology just probably a year and a half ago, and then really started focusing on working with some of his athletes and doing some data about a year ago. So he's engaged and collecting data, and really he's thinks that this technology has a real promising career in the elite sports world. He's got some of his Olympians doing it, and again, this is all first time stuff. I mean, he'd never even heard of it, and he's the guy that
And he's a cutting edge person. Like Cal Dietz really sets the tone for a lot of people. He's got a huge following in the independent performance world. Plus, obviously, he's a Division I strength coach. So through all the strength coaches, he's a very, very well-known name. He has an incredible system referred to as triphasic training, a very complex thinker, very detailed person, very data analytic driven. He functions in a very, very high competition world. He's always looking for better. And he does so many things, and he has so much experience throughout the world. And once again, this was a eye opener and a showstopper in terms of, okay, out of all the things that we're doing, this is a noticeable difference and advantage to integrate and even take place of certain things. You only have so much time. And this is something that is, when you really get it, you really start using it, it may replace some things you're doing.
Yeah, and he opened up, the door for the Minnesota Timberwolves. We started working with them last year. They were doing it for altitude training. They knew they had to go to Denver for a series in the playoffs, and so they just didn't play well there because the altitude always kind of was a little bit of a mental block, and it affected them, of course, physically. So they started, I guess, it was 3 weeks before that series started at the end of the year, knowing they would probably end up going there. And they jumped in, we went up and trained them and all that. And they were mainly doing it for the altitude training aspect of it. And so they had all their guys start doing it then. And they went out there and won that series, and just was like, wow, this was a major influence on us being able to do that just by, creating that desensitizing to the CO2. More red blood cells, EPO development, all that kind of stuff in the body. And so anyway, that was their story. We have a track team out in Kansas.
Not to interrupt you, so I don't want to interrupt, but that we talk about the recovery part of it. So I don't think clinicians, recovery means different to clinicians. They're probably looking at post-surgical and just people that are very low level physiological outputs. But when you work with athletes at any level, especially the elite athletes, it's all about recovery. The faster you can recover, the less predisposed to chronic repetitive stress injuries, the more you're going to play, the higher acuity level you're going to have mentally engaged. And the NBA season is brutal. By the end of the year, like people's legs are just fried. And so to prove what you guys did at that phase when they're in Minnesota and they didn't go out early because that's what they were consulting you with, we're considering leaving early. It costs an astronomical amount to go out there like 10 days early in order to pay the expenses, house all the players, everybody's out of their routine. So they were able to save a ton of money buying these units. This episode is brought to you by Viplate Whole Body Synchronous Vibration Platforms. If you're seeking an additional health and performance edge, ViBplate transforms exercise, recovery, rehab, and aging. Unlike typical vibration that uses a shaking stimulus, ViBplate's parallel wave synchronous vibration technology enhances and integrates muscle and brain connection like no other. Not only does ViBplate increase recruitment and improve neuromusculoskeletal function, it coordinates the brain-body communication and piezoelectric activity. For athletes, ViBplate optimizes warm-up and cool-down and can be used during peak performance exercises. With most units rated for 2,400 pounds, it's built for heavy lifting, intense training, and lasting durability. In rehab, it's a true game changer, accelerating circulation and recovery for sprains, strains, post-surgery, concussions, and many more measurable benefits to both patients and clinicians. For the elderly, it promotes graceful aging, preserving physical and mental health, even aiding those with severe degenerative conditions. Great for at-home use. Go to ViBplate.com to see all available models. At checkout, use code BBF15 to receive 15% off. That is BBF15 and advance your health and performance today. So before I interrupted you, I can't remember what you were going to after.
Yeah, we were just talking about some other teams and all and things. So and then oddly enough, the Denver Nuggets is the other team. Cal opened that door for them as well, and again, that's who they played in the series. And then we have the NFL. We've got the Arizona Cardinals, Tampa Bay Buccaneers. And Buddy Morris, he's a pretty well-known strength coach. He was one of the early on guys in this technology as well, so he's a big advocate of it. And then we've gotten into baseball a little bit, a lot more with individual players in baseball that are hearing about it. There's a functional doctor out in Arizona who's a big advocate of it as well, and I know him pretty well, and he'll send me guys individually who are trying to heal, recover, worried about neuro and brain stuff, concussions, and just performance type stuff. And then we've got several Olympians. There's an outfit in Texas, outside Austin, Texas, and he has had now 4 of his Olympians using the technology now as well, and then. Of course, some boxers, MMA fighters, just a spattering, across sports in general, cyclists. And again, still a pretty new technology. A lot of some of the strength coaches that I meet at the Division I level have a comment as recently as a few months ago, or 2 months ago, you have a conversation with them, they have no idea what this is, right? Yeah. So it's still unknown to a lot of people, but, like I said, Cal says that'll probably be changing.
Yeah. Right now, this is a training advantage. It is a secret weapon. It's been around in the world for decades, and we're going to hop into some research. There's a lot of people on this podcast that they like the validation of research, and rightfully so. We also don't want to just limit ourselves to research. The real world can tell some very definitive things. Strength and fitness is usually 20 to 50 years ahead of anything that's being proven by research. Obviously, oxygenation and CO2 is not new, but this type of delivery system, somewhat is far superior to breathing into a paper bag that people have been doing for a long time. But it is that premise of the Bohr effect and the Hadley effect, whichever direction you want to come look at it. But this is physiology that everybody was taught about. There just wasn't an application of doing it. And very exciting. So for those of you, there's other words you could pop in here. It is pretty new, but this is going to be a standard. So even in probably the performance world, because winning and losing on the field contributes to people getting hired and fired. And the people that have experience with this, you're just going to be a superior strength and conditioning coach, and your athletes are just going to have a tremendous advantage right now, besides eating properly and training properly. But in PubMed, if you go there and you type in intermittent hypoxia, normoxia, or hypoxia, hyperoxia, I know that's a mouthful, but you can see it if you're looking at the slide. Just those types of keywords, you get 210 results. And it's a wide variety, a lot of chronic diseases. If you type in intermittent hypoxia, hyperoxia, a little shorter wording, you get 155. When I first started doing this, I mean, you just look at right now, just in the last 10 years is where the majority of these studies in PubMed that are showing up come about. Here's one of the studies it talks about. This is titled Effectiveness of Intermittent Hypoxia-Hyperoxia Therapy in Different Pathologies with Possible Metabolic Implications. And so this what I just kind of like because it talks about the literature using the PRISMA methodology, which is the preferred reporting reviews and meta-analysis. And so this is a bunch of the most highly respected medical databases in the world: the National Center for Information, PubMed, Elsevier, Cochrane, Physiotherapy. Some of my words are covered up here with the windows that are open. But with this particular paper, they refer to, out of all those different medical research sites, a total of 923 research papers with them. And so then they really did a significant selection through these 923 papers, and 13 of the published studies were done in this meta-analysis of what they were looking at. And we start seeing research papers from around the world, Austria, numerous different years. And so they've done over 50 research papers on this. This shows starting as early as 2004, Slovenia, Japan in 2014, New Zealand 2016, China, of course, is doing a number of studies on this, Russia, Ukraine, Taiwan, Germany. So this is a very known factor throughout the world, and we're just a little slow right now here in the United States. But thankfully, we've got David at his company, and I've seen David present on this so many times and work on the elite athletes as well as the general consumer, and he is so good at communicating this. And also in this paper, it talks about specifically, so this was not to do with athletes, but very specifically, they're talking about how beneficial this is for chronic obstructive pulmonary disease, arterial hypertension, myocardial infarction, inflammatory immune responses to intermittent hypoxia, metabolic responses to intermittent hypoxia, bone, and the positive effects on tissue remodeling. So probably in America right now, there'd be medical doctors that would be like, oh, that's contraindicated for those things. And they know absolutely nothing about it, but people are always down on what they're not up on. And that's the farthest thing from the truth. That is specifically known to benefit those and really getting the attention of the medical community in other parts of the world. And like David said, it's not like there's not some doctors here that are doing this and they really get it. But sadly, the overwhelming majority will know nothing about it and say certain negative things, possibly.
Yeah, we've had really the last year and a half, I would say. When I've been in this for 8 years from since the beginning here of this particular technology, the IHHT. Of course, EWAT's been around for a long time, and this was derived from that. This just accelerates everything and creates another. I shouldn't say pathway. Actually, I should say pathway. It does create another pathway for oxygen to go deeper and to really activate things in the body to sort of wake it up. But we had very rarely any MDs at all, or nurses or nurse practitioners even that I would ever deal with or talk to. But the last year and a half, man, that has really accelerated. I've had many conversations and calls and consults with MDs, nurse practitioners, strength and conditioning, as we talked about, that would give it a second look because they'd never heard of it. So it is getting out there a little bit more in the medical community. I think now we're starting to see that movement is pretty key in healing some of these chronic diseases instead of just giving people stuff or having passive type treatments.
And to me, the academic explanation of this makes complete sense. As we talked about, just the importance of oxygenation and CO2 in oxidative reduction pathways throughout the whole body, just metabolism, nervous system metabolism, all of those things. But until you get on it, like this is one of those devices that I don't think it's hard to understand the benefits of it, especially how it compares differently to other exercise and oxygen methodologies. But once you get on it, it should be a really short report of finding, and you should be able to give quite a report on it just after your first session if you have any physiological background at all. But yeah, so I'm just going to have a slide up showing the conclusion of this one study and how they showed the benefits. The reviews highlights the merits of hypoxic, hyperoxic, and hypoxic normoxic therapy in various conditions and populations. The existing literature indicates that protocols consisting of exposure to mild levels of hypoxia for a small number of short episodes can lead to significant beneficial results if administered over several days or weeks. So it's a fantastic non-pharmacological treatment of what they're talking about here. Another conclusive aspect is just to really drive home how they're doing this, specifically with people with chronic obstructive pulmonary disease, myocardial infarctions, some of those, very concerning pathologies of a very weakened, frail individual. But again, it's that metabolism, as we show here, just the importance of carboxylic acid and oxygen, how that goes into the cell, goes through the mitochondria, goes through the Krebs cycle, and ultimately makes CO2 and water. So CO2 is the gas of life. It is not a waste product, as so many people think about. And this has been known for a long, long time, whether you're a climatologist or a physiologist. And once again, all of us who are clinicians, we were taught the Bohr effect at a certain point. Some people may or may not be as familiar with the Hadley effect. It's just the mirror image of what the Bohr effect is. So they're both true. Seems like Bohr effect gets a lot more attention. I also want to expand, because this does integrate so much with the popularity out there in terms of the mitochondria. So this is a game changer for mitochondrial health in combination with you're probably already doing. And we're not going to go too deep down this, but there's a lot of talk about seed oils right now. And if you listen to the people teaching the physiology of seed oils, one of the concerns, it's high linoleic acid, high arachidonic acid. Those things create prostaglandin E2. They create inflammation. Inflammation is the common denominator to all chronic degenerative diseases. Even under acute stress situations, inflammation can explode. And one of the aspects that's a very important keystone is the fats in your body. And again, we're going to just do a detailed podcast to the future of just fats that heal, fats that kill, and people understand this a little bit more, but we want to make it practical. So here are people taking so many unhealthy fats. When you look at labels, you got to start reading labels. And so many times people with these severe conditions, just for decades, they've eaten so many foods. It's just in everything unless you look for it and you eliminate those foods. Sunflower oil, safflower oil, canola oil, cottonseed oil, which is one of the craziest things because animals and humans don't eat cotton. But yet we're making cottonseed oil and we're putting it in everything. I mean, it is one of the most bizarre things that when you really get into what they spray on the cotton fields before they harvest it, it is some of the most toxic chemicals. And so not only we're eating cotton, which has no biological value in people at all, but now you're getting all these toxins in the cotton. It is just crazy. So when we look at this list right here, it's very, very important, even though this will work without making these adaptations. But when we're working for long-term benefits, like truly changing people's lives long-term to where they had these debilitating conditions, you got to look at lifestyle. You're going to have to look at what people are putting in their mouth as well. And for any reason, if you're like, well, it plateaued or it didn't do this, when you start taking people's history of these things, it will be loaded with this junk. And so the 5 products on the left, even though a lot of people consider olive oil very healthy, the hardcore people in today's day and age that are teaching the bioenergetic method of eating, they're even against olive oil. And I'm not going to argue with them. I think it's fantastic. They're pushing those upper limits of no compromise on helping people's physiology. Olive oil, it's a little bit of you get what you pay for. You can have an astronomical amount of linoleic acid in olive oil, or if you buy the real expensive stuff, low oxidation, it could still have 9 to 11% in it, but it can get up to 32%, which is crazy astronomical high. And you would not want to eat those types of things. Avocado oil spray, there's a lot of people that would say, you can do better than that. And you can. I'm not against my clients using that. It's super convenient, very convenient spritz, but we do like people to favor the grass-fed butter, the 0 acre, the gold coconut, the organic grass-fed butters and ghee. Obviously now we even have beef tallow that's available out there. Those have huge game changers for too many reasons outside of this, but these things do integrate, especially to clinicians. And one of the mission statements of Brain Body Fit is to make better doctors by helping them understand the elite benefits of the strength and fitness world. The strength and fitness world is hands down doing the best lifestyle medicine and the biggest changes when it comes to diet, exercise, movement, correcting asymmetries. They're fantastic. Not everybody, of course, but it has so much to offer and prove these benefits. Now, on the flip side, though, if I was the world's greatest strength coach and conditioning coach, which I'm not, but if I was, I have so many advantages of what I can do as a clinician. I can see things in seconds that they'll never see, whether it's orthoneuro exams, but also the ability to do these lab testing and these ratios in the body, such as arachidonic acid, icosapentaenoic acid, as we're showing here in this category. This is one of the most important ratios in your body. It's not the end all be all, but it is a massive foundation of health. And this is greatly going to affect inflammation. The mitochondrial chain is going to affect the receptors on the cell membrane, because every cell in your body's cell membrane is made up of fat. And it's made up of whatever fat you eat. So if you eat Doritos, that's going to resemble your cell membranes. And you need the receptors in the cell membrane to be very fluid. The more fluid your cell membranes, the healthier your cell membranes and the healthier opportunity of your cells. When you eat processed refined foods, especially these horrible seed oils that are literally in everything, it causes exponential huge problems and it won't fix itself. So just as this picture states, that ratio of arachidonic acid to icosapentaenoic acid should be 1.5 if you want to be obsessive compulsive perfect, and up to 4 is considered healthy. Well, we show this person who's at 42. And again, we do use fish oil, and people who are worried about the oxidation or vilifying fish oil, I get it. If you want to do that, that's completely fine. We do a tremendous amount of clean eating, as you learned from this podcast. So we're really removing low quality foods, which will help this. But I'm always way more impatient than my patients are. And it's the EPA specifically that's going to offset this, and fish oil are a great source. Now, we do give people very high antioxidants while they do this, even if we're doing pretty aggressive fish oils at that time, but we're just fixing this ratio. And ultimately, this is helping everything David's going to mention as well. As powerful as intermittent hypoxic-hyperoxic training is, it's not magically going to turn into a healthy essential fatty acid. So this is just something, again, with basic integration, you could just get unbelievable paramount results. And so in particular, just to kind of show you, this is a very typical thing, pre-test, post-test. It's the same person. 3 months later, they went from 42, which is super high inflammation and doom if they stay that way long enough. And in 3 months, we got him down to 2.1. Then we'll put him on a maintenance dose. He's eating cleaner as well, as we really took apart their diet, but also supplementation helped with this. And hands down in the whole process, we're doing what David's explaining. They're getting in better condition. Their physiology is healing because of the O2, CO2 delivery. And what all these things, when you eat a bunch of crummy oils and you have these high inflammation rates in your body, it literally plugs up the electrons from moving through the electron transport system. So David's system kind of acts like a turbo. So anybody who's into motors, the faster you can move fuel and oxygen through the system, that's what a turbo does. And that's what he's doing with our metabolism. So when things really get stuck, it just improves that flow of fuel, which is food, but also how the oxygen and CO2, just review your Krebs cycle a little bit there. You're going to see exactly where it places in there. And then another thing, just to touch base on this, the arachidonic acid supplements will not help, such as fish oil, will not affect the arachidonic acid at all. Research shows they like that 9 or below. You're not going to get it much below that because you do need some inflammation. I mean, you want your inflammation at 1.5 because you need enough inflammation in your body for you to have a fever when you get exposed to bacteria and viruses. So you don't want to go below those numbers because your immune system would start getting compromised as well. But here we see, and this is because of a changed diet as well as with our supplementation and measurement data analytics that we're doing of just at 3 months, how far they went down. I was really proud of this person because he's just an average person. I can't say he lived overly healthy, but obviously lab tests don't lie, but it's that whole combination of the system. Many of you that are listening are very, very familiar with lasers and the benefits of mitochondria to the entire cascade as well. And you're completely right. But the beautiful thing I love about this is you can be doing so many different activities and you put the lasers in the stand, whether you're using the FXs, whether you're using the handhelds. You guys are aware of the different phases of the mitochondria, even different wavelengths. So this all stacks on top of each other. It's not like one's a substitute. They integrate very well. You could just use one or the other, but many of you are always looking at how can I help more people do a better job? And actually, as a clinician, not even work harder. And these are such perfect, as you guys know, how big I am in unattended active stations. And even when using David's system, you do want to supervise, but you can do multiple people at a time. But you do run that switch as far as turning on high concentration and then combating with the CO2. So all of these things, understand not just oxygenation is the benefit, but CO2. And if you kind of forgot how important CO2 is to the whole mechanism, just go back and read the Bohr effect, I would say. And another neat fact of how we as humans integrate with the natural order of life. And humans, we need oxygen to survive, but we give off CO2. And to plants, CO2 is the plant's oxygen. So that's what they need to thrive and go through photosynthesis. And as a side effect, then plants release oxygen. So CO2 has been vilified, especially in the propaganda of climate. We need to recycle and we need to get heavy metals. We need to fix process refined foods, all the toxins. CO2 is not the problem. That is one of the most stupid propaganda bullshit that has been shoved down people's throats so much. And obviously everything goes in balance, but we're not even close to being too high in CO2 as a planet. But this is how these things work together. Our physiology and optimum health of a human will promote optimum health of the planet, and how these things work together, completely synergistic. Here's just a couple clinical things, as you guys are very familiar, especially this is just geared towards the PEMF crowd, the laser crowd. In the far right picture, this person's doing things very passive. We don't even have the IHHT on him at this point, but you can see where that would fit. Definitely just sitting in the chair isn't going to give us those maximum benefits we want, but this is how we use PEMF and laser all the time. And it's so easy to put some simple activity to it, doing IHHT, a total game changer for those of you that this is a very common thought, using PEMF and lasers in this context already. One last study I'll talk about, because the brain is such a big deal. So you're going to look in PubMed in the research studies, and it is not uncommon, that they really promote this for brain health. The brain is incredibly metabolically active. Oxygen and CO2 is huge part for brain health. And especially where they talk about recently, there's a great medical and scientific interest in the association of intermittent hypoxia. It is a hallmark of metabolic dysfunction and dementia. Cellular studies have indicated that intermittent hypoxia influences the expression of various genes related to metabolism in various cells, and that intermittent hypoxia may induce decreased appetite, impaired glucose tolerance, insulin resistance, hypertension, cardiovascular dysfunction. And then, of course, we get into the whole exercise physiology, which they're not even mentioning. Here's another just short picture and another review study titled The Impact of Intermittent Hypoxia on Metabolism and Cognition. And it is overwhelmingly positive by these researchers who, show incredible benefits to these very, very common chronic degenerative diseases that are one of the top plagues of our healthcare system today. So this is absolutely going to be a standard of care. It's just a matter of getting that message out to people and you guys manufacturing them fast enough. So what would you like to add, David? That's all the information. I just kind of wanted to integrate specific to the clinicians that have been to a lot of our seminars, already carry a lot of equipment, so they see how this pairs together. Where else would you like to go today?
Yeah, I think, you were talking about the CO2 effect, hypoxia, both of those terms tend to have a negative connotation to a lot of people, but, that's the motor that makes all this run, at least for us, right? When we're working with people, because, if you give them all the good stuff only, you can only go so far. You're going to be very limited on what you can do with them. But when you can start creating, we're always trying to get more CO2 into the blood, and that's why we really focus on nasal breathing. Because when you just mouth breathe, you blow too much CO2 out, you don't have enough in the blood, and then the delivery from the hemoglobin to the tissue is just partial. It's just not near as efficient. So we're constantly preaching that, like, hey, nasal in, nasal out, nasal in, nasal out while you're doing your session, because we got to have that CO2 in the blood, because if we don't have enough CO2 in the blood, that's not going to work the way it should, right? So that efficiency is really important. And then the other thing would be the hypoxia. When someone walks in that's got a chronic disease that I have to deal with, the worse off they are, my first thought is they need more hypoxia, in the sense that the only way to drive the oxygen deep enough to really give them a benefit is to create a demand for the oxygen via the hypoxia. So that's all really key. And when we're afraid of those things, then you're going to be very limited with this technology and what you can do. So it's really learning how to use it properly, getting trained properly to be able to identify, how to use the hypoxia with the oxygen together to really get an effect.
And that's the unfortunate problem of today. What you just mentioned about the importance of CO2, that has been known and written in distinct detail since 1904 when the Bohr effect was published. And that's standard physiology. That's not just specific to this. Like, there has been such detail over 100 years ago written about the importance of CO2 in our health, and how the CO2 is what makes the oxygen more sensitive to bind to it. And it actually acts as a guiding system. So when tissues become higher in CO2 concentration, that completely sends cell signals to take the oxygen in your body into those hypoxic cells. That's exactly how it works together. And somehow the standard clinician has completely lost that, forgot it. I have no idea. To me, it makes absolutely no sense, even if they don't teach you those things in school, which they did. They taught you the Bohr effect. It is impossible to be a licensed clinician without taking that on a test a few times. But how people do not apply that into real life, it is very interesting in a whole phenomenon in itself. But the machine and technology is somewhat new, even though we start seeing other countries using this in the early 2000s. But this is really something I encourage everybody to look at. Incredibly safe, incredibly effective. And you can't have a better person to teach you with more experience in protocols than David himself. So unless you have something else to add, David, this was fantastic. I know there's a lot of information we can go on, but hopefully people are interested enough. They can go to your website. I have that up on the screen right now. It is O2PANDR.com. And that's the name of your business. If I'll just let you describe that of the name.
Yeah, O2 Performance and Recovery is the name of the company here, the business. And we have a studio here in Athens, Georgia, where we have clients that work with them. And then I also do a lot of training as well. And I travel. So I do some video training, Zoom and all. And then also really for teams, maybe a wellness center, doctor's office, we have a few people that need to be trained. A 1 day, 6-hour training, you kind of get everything. And so I used to do a lot of those. I've cut back on those because of all the travel, but I still do those when needed. So we do training, and then we also have clients here, and then work with some teams and athletes on an individual basis and consulting as well. Yeah, go check us out, o2pnr.com.
And then obviously your email is going to be on your website as well. But if you just want to shoot off your email, if somebody's writing it down right now, if they can't see the screen.
Yep. David at o2pnr.com. It looks like David at O2Pander without the E. And so if somebody wants to, you can send a direct message, through my email, and I have times where, we can have a consultation. You can book that. They're on my website. Those interested in the technology and maybe buying the technology or having it in your facility, in your clinic, in your office. We use Airo, AIRO.com, and I'm part of them as well, just full disclosure. And their technology is app driven and all that. But those people interested in that, the consultation, we can also discuss and talk about that and get into how they work and what would be appropriate for you, depending on what your needs are.
But yeah, contact David directly. And are you going to do anything special for the Brain Body Fit crowd in terms of if they are interested in contacting you, and if anybody was interested in buying a unit? And I also want to stress, there's a lot of home buyers that buy this because there's not enough clinicians doing this right now. So this would extend to any consumer home buyers. You do a lot of trading. So was there some special promotion that you want?
Yeah, you can do one thing we'll do is do the free shipping, which is usually about $250. So we're basically doing a $250 off. So if you listen to the podcast, and if you mention that, I think you have a code and all that we can do for that.
And thanks for doing that for the listeners. It's going to be a great experience for you guys. So we'll get this set up. It's going to be BBF 250. So Brain Body Fit 250, but it's just going to be shortened to BBF 250. We're going to have this listed on our website in a section with all the affiliates of the Brain Body Fit podcast. You'll always be able to go through there. And it will take you to be able to purchase from all of our affiliates, because we just can't, we don't want to inundate this show with commercials, but we have so many great people and great products that we've used it sometimes for a couple decades. And we just love the people behind the scenes, as well as the quality of the products and how they interact together and how they integrate. That's a really big part of what we want to do with Brain Body Fit. Health is not just a silver bullet, but we can find devices like this that absolutely can be used all by themselves, and you will notice a huge change. And of course, we want to give incentives to people who work with the show. And we love introducing people to people like David and these great companies out there. So thanks a lot, David. I know you're busy today. Thanks everybody for attending this, and go to o2pandr.com and you'll look at a great website, get more information, and reach out to David if you're interested. Everybody have a great day. Thank you for listening to the Brain Body Fit podcast, where we are dedicated to helping doctors and clients integrate clinical evaluation and performance enhancement. Please like and share this episode with someone who wants to empower their own health and actively participate in the health revolution of the growing millions. Epic changes are real. Visit us at performancepractic.com, where you can explore premium selected products and services that we have used to change the lives of thousands in our clinic and seminars for decades. Follow us on our socials. All the links are listed in the podcast description.